So this might be the most unusual lectureship in your entire history at Villanova, because I'm actually not going to be presenting on what I said I was going to be presenting. I thank Dean Fitzpatrick for inviting me here many months ago, and I was excited to come, but especially because I have my future nursing scholars here, and they're very special to me, and nursing students are very special to me. But I want to tell you, in order to be authentic to my life circumstances at the moment, I will not be presenting, actually. I will instead tell you a story of where I am in my life circumstances and what is important to me, and then I will turn it over to my good colleague Beth Ann Swan to actually do the presenting. About 6 weeks ago or so, 5 weeks ago or so, my husband was biking on a Sunday morning, and I was actually at a meeting here in Philadelphia, which is why it was especially hard for me to keep this commitment in Philadelphia. He was biking and he had a very bad accident and was immediately paralyzed from the neck down. And then for 10 days, he fought for his life, and he fought pretty hard to stay alive, and he did not make it. And my life was turned inside out and outside in, and actually, to be more accurate, was ripped into shreds. And if you've never experienced anything like this, and I hope you don't, it's pretty unbelievable, and it's still very unbelievable to me. So it was really just last month that he lost his life, and I lost my best friend. But for some reason, even though I canceled everything on my calendar, and I do a lot of public speaking, and I thrive on public speaking, and I love nursing students in particular, it is anxiety-provoking for me to be here in the city where he lost his life. But I decided after long thought and long discussion with Beth Ann and Abby, there you are right here, about what I could most authentically do right now in my life and what message I might have for you. So as not to traumatize you any further and spare you the details. But I wanted to let you know that you're certainly in the right profession, because it's one thing to be a nurse and to feel called to be a nurse. And it's quite another thing to be the recipient of nursing care. And my husband and I were the recipient of wonderful nursing care. But I will tell you that there are things that stood out for me in the 10 days that he fought for his life that I want to share with you. 3 nurses in particular. And the first one, they first took him to Helene Full Trauma Center, and I met, there's not a lot that I remember about those first couple of days, but I do remember being in a room with a colleague of mine, a friend of mine, and a nurse coming in. And the only reason I would remember this nurse in particular was because I saw her name tag, and her name tag was the same as my granddaughter. And my granddaughter is a very special person in my life. She just turned 3 the other day. And her name was Abby. And this person did not know I was a nurse. but she comforted me and told me she cared. I don't remember all of her words, but I remember her eyes in particular, and I remember her touch. And that was really, really important to me. And then probably day 5 into my husband's fight for his life, I saw an email in my inbox. And I wasn't really looking at email. As I said, I canceled my whole life. My whole life was just canceled. I'm not going to do anything. Wasn't answering emails. I started a blog in the beginning to let people know what was going on, because so many people were coming at me. You had to find a way to give people information while protecting yourself. But I noticed there was an email in my inbox, and it was from a person that I didn't know, and so I especially didn't want to open it. But then it came again, and it came again, and I decided to open it. And I'm going to read you that email. I have not stopped thinking about Bob, my husband, since I was called to the trauma bay as he was being brought in after his accident. I met you briefly in the ICU waiting room that evening and wish I could have done more to ease your pain. I hoped in some small way, knowing that Bob was coherent and calm in the time frame I spent with him before we placed a breathing tube, would provide comfort. I knew there was little more I could say or do as you were grappling with life's worst news. I was hopeful for you and for Bob that positive updates might meet me when I next returned to the hospital, but I was unable to gather any information as I learned that Bob had been transferred to another facility. He was helicoptered then to Jefferson. My heart continued to ache in the coming days as I pondered over how tragic it is that a person can be healthy and enjoying life one minute and then suffer a life-changing, devastating injury the next. Despite years of healthcare experience, the set of circumstances weighed heavily on me. Perhaps it is because Bob reminded me so much of my own bike-riding 68-year-old father, or perhaps it is because when I looked into Bob's eyes to explain what I needed to do, I felt a soul-piercing sensation that Bob was a wonderful man. Now, after learning more about Bob, his life's work, his personality, his example as a husband, father, grandfather, I know my instinct was spot on. At this point, she had found my blog. I have no idea, but the blog speaks of my husband a lot. My brief but powerful encounter with Bob is what compelled me to continue to seek updates and now to contact you despite my fears that this is not professional for me to do and likely not supported by my employment administration. But at some point you have to question why you became a nurse in the first place and follow your heart. As an oncology nurse early in my career, I had many patients contact me after they no longer were under my care, but I have never, ever before contacted a patient or their family member. Unfortunately, I'm cognizant that much like when I sat across the table from you in that ICU waiting lounge, there's little I can do or say to make the situation any less painful. I hope the love of your family and friends cocoons you and protects you in the difficult weeks and months to come. Know that Bob's life had an immense impact on those he met only briefly, and the ripple effect has only just begun. And then I got back to her and I asked her, did he say anything? What was it like? I asked for a little bit more information, and she said to me, Bob stood out because despite the fact that he let us know he could not feel his body anymore from the chest down, and that his neck was sore, he had a very distinct cool about him. Aha, light bulbs went off in my head as I read your blog and first learned that Bob had been involved with disaster relief, American Red Cross disaster relief, is a real leader in his field, has military experience, is a Purple Heart veteran, and is a helper by nature. When I am preparing to assist someone into a state of sleep, I learned at this point she was a nurse anesthetist. Whenever I am preparing to assist someone into a state of sleep, I tell them to think happy thoughts. Let your dreams be good ones while you sleep as they drift into unconsciousness in what I hope is more peaceful and relaxed mindset. I am sure, as I gave Bob these instructions and he closed his eyes, he was envisioning you. As a follow-up to what I said previously regarding someone being so lucky to have a person like Bob by their side, I'd like to add that I am so thankful a person like Bob was blessed, rewarded, to have someone who cared for him so deeply and made him so happy. Love stories like yours don't happen too often. As an oncology nurse, early in my career, I had first row seats to life's final moments, more often than I ever wanted. As much as I needed to be there for family, friends, family members during those tough moments, it was heartbreaking, especially as people conveyed their regrets to me. I get the sense that neither Bob nor you live a life of regrets, and this brings joy to my heart and some semblance of sense back to the universe. Watching some of my patients truly suffer in what felt like an eternity, sometimes as family members grappled and suffered themselves, was hell on earth. I know right now you wish nothing more than Bob's presence, but I hope eventually this will provide you comfort too. Thank you for being Bob's advocate and best friend to the end. My heart remains with you this weekend as you navigate more emotionally exhausting experiences. Take it moment by moment, give your brain a rest, and just allow your heart to take over and guide you through the process, and Bob will help you. That's from a nurse. I never met that person. She didn't know me, I didn't know her. I'd like to think that that is the way she carried out her job, her calling. I use Beth Ann as an example too, as a nurse. I didn't know Beth Ann very well either. She is one of our Robert Wood Johnson Foundation Executive Nurse Fellows. But when she found out I was coming to Jefferson, she was my greatest advocate for Bob and for me. And she kicked in not only her friendship, but really her experience as a nurse, as someone only a nurse could do. And I really owe Beth Ann a great deal of gratitude and love for what she did for me as a nurse. And then finally, there were other people, there were other nurses, but another one stands out, and Michelle will know this nurse, and it was on the last night of Bob's life. And it was anxiety provoking to make decisions about life and death, and when machines get turned on and off. It becomes routine for nurses. It becomes routine to have so many procedures and tubes and everything. But to a family member, it's not routine. That's your life. That's your heart. And when I had to make those decisions, there was a nurse there by my side to help me and guide me in when the machine might get turned off, in what time frame, what kind of medication. And then when the time was getting closer and I knew her shift was coming to an end, I knew that both she and I were getting anxious about Bob leaving us. And she was almost yelling at him because she didn't want to leave. She didn't want to leave me. I know she didn't want to leave me, and she didn't want to leave Bob. And so she was yelling at him, "It's okay, it's okay." And then she asked me if I wanted to turn off the machine completely. And I said, it was past the end of her shift. She had her coat on, she had her purse crisscrossed across her chest, ready to bolt out to her car. And when she knew I really wanted her there, she said, of course. She ripped her coat off and took her purse and flew it back into the office and just stayed with me, and just stayed with me. And so, my message to you, I'm really good in my job at the foundation in encouraging nurses to, use their critical judgment and their experience and continue your degrees and make sure you get your research right and all of that I've been preaching over this last several years. But if you don't have care and compassion as a nurse, and if this is not your calling, then all of those things mean nothing. And I hope that everyone in this room is in this profession for the right reason, because you feel it is your calling. And you never believe that it is unprofessional to touch someone, to care for someone, to use the words that Abby used to me, that I will treasure always, and I read at Bob's memorial service, because these are nurses that made a big difference in my life, and I will never, ever, ever forget them. So go forward with care and compassion, the other things as well, but care and compassion, because that's what matters most. And now I'm going to turn it over to Beth Ann Swan to actually do some of my presentation. Thank you.
Good evening, and I'd like to thank Dean Fitzpatrick and Evie for allowing me to accompany Sue this evening. I first want to thank Dr. Susan Hassmiller for her strength, her grace, her courage, her ability to communicate and articulate the true meaning of the future of nursing and the campaign for action. Dr. Hassmiller is the leader, the architect of the future of nursing, and advocates for nurses every waking and sleeping hour. It's in her DNA. She is here tonight, as you heard, telling an illustrative, very personal story. And she tells her story because narrative matters. Her family's story is emblematic of what many families experience when they find themselves confronted with the unimaginable. Sue's story is a call to action. The story links with present-day national initiatives of the Robert Wood Johnson Foundation focused on the future of nursing, the campaign for action, and the culture of health, and connects with educating nurses about required competencies, knowledge, skills, and attitudes to be well prepared for leadership and professionalism. As I describe the Robert Wood Johnson Foundation's future of nursing and culture of health, I'd like you to think about how each of us participates in this work by first looking inward at ourselves. Our ability to be authentic, our ability to be purposeful, our ability to be present, our ability to be kind, and most of all, our ability to be humanistic. Whether you care for someone for 9 seconds, 9 minutes, 9 hours, 9 days, 9 weeks, 9 months, or longer, during every increment of time, please be present, intentional, and thoughtful with your care. For each increment of time impacts the individual and family you are caring for in profound ways. For individuals and families, every second is like a day, and time moves very slowly in freeze frames. For you as nurses, time is rapid-fire blurred speed, and these two realities are not synchronized. And families are challenged to assimilate what is happening. And the best thing that we can do as nurses is support the synchronization of how the family and the person you're caring for is, and your ability to bridge that difference in reality. Just get organized here. So as Sue said, nursing is a calling, and many of you have chosen nursing because you care. You want to help others when they're at their most vulnerable. And Abby, the nurse that Sue read her email, really epitomizes what it means to be compassionate and to truly make a difference to someone who needs to be lifted up. And as Sue said, she's still wondering, how did Abby find me? But it was meant to be. So nurses like Abby bring a unique and important perspective to individuals and families for their community. Nurses repeatedly rank at the most trusted health professional, and they're really the backbone of our healthcare system. As nursing students and as professional nurses, you will be vital to improving quality. If you decide to work in a hospital, you'll help reduce rehospitalizations by supporting the transition from hospital to a person's home in their community. If you work in schools or the community, you'll help people to live healthier lives. And again, just as Sue's narrative matters, your voices matter. And that makes you leaders. And as student nurses and future professional nurses, it's part of your everyday professional life. You lead when you advocate, you lead when you act decisively under stressful situations to benefit the people you care for. You lead when you direct, when you delegate, when you supervise, and when you coordinate care. And that is what the future of nursing is all about. So the Institute of Medicine, now called the National Academies of Medicine, released a landmark report 6 years ago about the future of nursing that stated nursing must be prepared for health system transformation and that nurses must help lead and shape this health system transformation. And after this report was released, the Robert Wood Johnson Foundation, the nation's largest health philanthropy, and the American Association of Retired Persons, AARP, the nation's largest consumer organization, believed the recommendations were too important to sit on a shelf. So together in 2010, they launched a national initiative to improve health through nursing called the Future of Nursing Campaign for Action. The campaign works at both the national level and in the states, including Pennsylvania. And by a show of hands, how many of you are signed up for those alerts from the Pennsylvania Regional Action Coalition? All right, we have a few hands. We need more nursing students getting registered and getting those alerts. So the campaign works to engage with consumers, nurses, other clinicians, healthcare systems, insurers, stakeholders, employers, educators, funders, policymakers, everyone who needs to be involved in system change and advance the IOM recommendations. So the goal of the campaign is to prepare the nursing workforce to provide top-notch care by strengthening nursing education, nursing practice, and nursing leadership. The Action Coalitions have raised nearly $20 million in funding. Members include a wide range of healthcare providers, consumer advocates, policymakers, business, academic, and philanthropic leaders. Together, we are working to implement our vision that everyone in America can live a healthier life, supported by a system in which nurses are essential partners in providing care and promoting health. So the campaign is focused on 5 areas, which I'll briefly discuss. So nursing education. Action coalitions have been working to strengthen nursing education programs so that more nurses are prepared throughout their careers to care for the onslaught of a more diverse, aging, and sicker population. That means ensuring that all nurses are keeping current of the latest trends and continually learning. It also means more nurses continuing their education to earn baccalaureate degrees and higher. And that's happening. More nurses are earning a baccalaureate degree after an associate's degree, and in 2012, more nurses graduated with a baccalaureate degree than an associate's degree for the first time ever. The campaign is also working to remove barriers to practice. Primary care in the United States is struggling to meet demand. Staffing shortages are expected to get worse as millions of newly insured Americans seek care. The population continues to age, and people grapple with even more chronic disease. This is particularly true in the underserved, rural, and minority communities. Nurse practitioners provide an immediate and cost-effective solution to this problem, enabling physicians to direct their energy to caring for people with complex medical conditions. But outdated barriers are blocking the ability of APRNs and other providers to expand access to care. We need to remove these barriers and use clinicians more efficiently and effectively so that consumers can get the care they need, when they need it, where they need it. We need to ensure that people receive the right care by the right clinician at the right time in the right place. And since the start of the campaign, 8 states, Connecticut, Maryland, Minnesota, Nebraska, Nevada, North Dakota, Rhode Island, and Vermont have removed statutory barriers that had prevented nurse practitioners from providing care to the full extent of their education and training. Right now, nurse practitioners in 20 states and the District of Columbia have full practice authority. Leadership. The IOM report stresses the need to promote nursing leadership and prepare nurses for board positions. And that starts at every level. See yourselves as leaders and volunteer for leadership positions early on in your career. Get involved in a professional nursing association. Continue to build your skills so that you can take a leadership role with increasing responsibilities. And here we have our case study sitting before us, who early on in her nursing career was an American Red Cross volunteer, and that has stayed with her her entire life. The campaign's goal is to get more nurses appointed to health and community boards. It helped to form the Nurses on Boards Coalition and has a goal of placing 10,000 nurses on boards by 2020. And as of November 10th, 2,356 nurses have been placed on boards. So we need some of you to get us closer to 10,000. Another area that the campaign is working on is interprofessional collaboration. Together, we are promoting a team-based approach to education and practice to improve the quality and coordination of healthcare. Studies have demonstrated that effective coordination and communication among health professionals can enhance the quality and safety of care. When health professionals work together collaboratively as integrated teams, they draw on individual and collective skills and experiences across their disciplines. This results in better health outcomes, including higher levels of satisfaction of services and improved wellness and preventive care. And at many nursing schools, and Villanova at the top there, have increased the number of interprofessional education and practice opportunities that are offered. Diversity. The campaign and our partners are working to recruit and prepare the nursing profession to provide culturally competent care in a variety of settings to an aging and more ethnically diverse population with more chronic illnesses. Nearly all the action coalitions are incorporating diversity plans into their education and leadership efforts, so we're increasing the number of diverse nurses with a BSN degree and higher with leadership skills. We're proud of our work, and we're going to continue to implement the IOM recommendations so that we can truly improve health through nursing. We need all of you to get involved in the campaign if you aren't already. You can go to www.thecampaignforaction.org and click on Get Involved. So everybody over here, I didn't see one hand over here, needs to get on your phones, go there, click it, click Get Involved, and then join your state action coalition. The progress that the nursing field has made in advancing the IOM recommendations has prepared us to take on leadership roles in the movement to build a culture of health. And by that, the foundation means enabling all people to live the healthiest lives possible. We need diverse, well-educated nurses with strong leadership and interprofessional skills who can practice to the full extent of their education and training to build a culture of health. Advancing the recommendations in each area will help to enable all people to live the healthiest lives possible. So the campaign will be more focused in the next few years in reaching to new and diverse stakeholders to help all people live healthier lives. So why is this important? Why does everybody need to live a healthier life? In today's America, too many people's health is tied to how much money they make, how much school they've completed, and the neighborhoods they live in. People's health has a lot to do with the individual decisions they make, that's for sure. But the choices that we all make are based on the choices that we have. If we want everyone in America to be able to lead a healthier life, we need to address all the factors that affect health. And these social determinants of health, including poverty, inequity, violence, poor housing, lack of a good education, lack of jobs, lack of access to healthy food or safe places to play, are responsible for an estimated 80% of all illnesses. Only 20% can be attributed to biological causes alone. In fact, your zip code may be a better indicator of your health than your genetics. And that's saying something. For example, babies born in the Philadelphia zip codes only 5 miles apart face up to a 20-year difference in life expectancy. That's why we need to build a culture of health. Many organizations are working together to take one of the most pervasive challenges of our time, improving the health and well-being of everyone in America. A culture of health places well-being at the center of every aspect of life, so that all communities can flourish and all individuals thrive, regardless of race, creed, income, or location. It's built on the premise that everyone deserves to live the healthiest life possible. And it'll take many partners to shift towards a society that places everyone's health and well-being at the center of every aspect of life, including in areas that we may not traditionally associate with healthy living, such as city and urban design, public transportation, and education. That means we need to partner with a wide variety of groups. And nurses have a major role to play in helping people lead healthier lives. We make up the largest segment of the health and healthcare workforce. We spend the most time with people, families, and communities. We promote prevention, wellness, and provide population-focused services to entire communities. There are countless examples of nurses partnering with others to help people lead healthier lives. And one of Sue's favorite examples is Penn School of Nursing graduate Melanie Mariano. She's using her Penn's President Engagement Prize to help Philadelphia's public libraries become hubs of health information and preventative health care for the city's residents. She established a partnership with the Free Library of Philadelphia, whose leadership was eager to give visitors the chance to improve their health literacy. Melanie will connect individuals with resources to address existing health concerns, provide preventive care tips, and offer in-house screenings for blood pressure, height, weight, vision, and hearing, along with advice on what to do if the results are out of normal ranges. As the project evolves, she'd like to expand across the city to involve nurses from neighborhood clinics who would spend time in other free library branches, perhaps even providing first aid and immunizations. All of you have a role in building a culture of health. It starts from within when you synchronize caring for others with caring for yourself. And that ripples to caring for your patients and their families and communities. And it expands when you consider the factors that brought a person to the hospital to try to take steps to address them. Ask why they are there. Were they taking their meds? Do they live in a home with poor air quality? Do they have a safe place to exercise in their neighborhood? Ask the person and set them up with other organizations if they need it as part of your planning for that person and that family. The truth is that while nurses work in many sectors, all nurses need to be versed in all of the complex social factors that influence health, including income, education, ethnicity, and where we live. Some hospitals employ a social worker who can refer patients to needed services, and that is something that you could encourage your hospital to do if you don't already have that. It'll take a little bit more of your time, but asking about a person's family, their home, and experiences is part of holistic nursing practice. So be driven to be your best, not for yourselves, but for others. It's our duty, the essence of nursing. It's our calling to nursing, to provide human caring at the individual, community, state, and national levels. It's nursing's leadership at its very best. So Sue would like to leave you with the words of one of her role models, Sheryl Sandberg, the Chief Operating Officer of Facebook. And Sheryl says, "It's the ultimate luxury to combine passion and contribution. It's also a very clear path to happiness." So you've already combined passion and contribution by answering the call to become a nurse. Your voice is valued and trusted, and your perspective is crucial to enabling people to lead healthier lives. I know, and Sue knows, that you'll use your voice to make a profound difference to build a culture of health and enable all people to lead healthier lives. This is the role the future of nursing and the Campaign for Action plays in each of our lives. Your choice, your decision is what role you will play, what role you will accept, what role you will model. Professionalism, leadership development, volunteer leadership, and mentoring. As nursing students and future professional registered nurses, the change work that all of you will do will inspire each of us. And with each of us, there is hope for sustainable change related to the future of nursing and culture of health. Thank you.